Good morning, good afternoon, and good evening to workshop attendees. Thank you so much for joining us this morning. We're delighted you're joining us for session 2.1 on adopting the WHO framework on sustainability, what it means for implementers and health ministries. My name is Aparna Adams. I'm the project manager at the International Coalition for Trachoma Control, and I'll be leading today's workshop with my colleague, Carolyn Henry. Carolyn, over to you for a quick introduction.
Yeah, hi. Really nice to be on the session today, really exciting. My name's Carolyn, I'm the Senior Programme Advisor at the SCI Foundation, and I'm part of the NNN Sustainability Working Group. So yeah, really looking forward to hearing everyone's suggestion and input today. So yeah, back over to you, Aparna.
Thank you. So I have a few housekeeping notes before we continue on with today's session. You'll notice that you've entered the workshop with your camera off and audio muted. Please keep your audio muted to help keep background noise to a minimum. If you are invited to speak, please unmute yourself by pressing the microphone in the bottom left-hand corner, and feel free to switch on your video again by using the button on the left. Carolyn, could you turn over some of the PowerPoint slides to the next session? Oh, not the next session, the next slide.
Sorry.
That's okay. Wonderful. And the next one, please. Great. So if you'd like to interact during the session, you'll notice today that we've actually got the Zoom chat box function fully operating. So you can use that, or you can also use the chat box that's on the virtual platform. If you have any issues with losing connectivity, please email the MYT team on admin@nnnevents.com. One of the final bits of housekeeping is that we'll be using two interactive tools during today's session. One is Jamboard and one is Poll Everywhere, and you'll see both those links are in the Zoom chat box for people to log on to. These will come up really handy throughout today's session, and you can use and connect onto these through your phone or your laptop. I also want to make a note that today's session will be recorded, and so you'll have an opportunity to view the whole workshop session after the NNN conference as well. So thank you very much, and now over to Carolyn.
Great, so we've introduced ourselves here. So it's myself and Aparna who will be hosting along with our colleagues. But what would be great is if, yeah, as we keep saying, it'd be lovely to be interactive. So for those of you who can see on the chat, we'll be now going to do our first poll. So you can go to www.pollev.com /Carolyn Henry 168, but the link is in the chat, so you can just go on there. And what we'd love to do is just to find out who you are, who's in the session. So if you could click one of these options on your screen, that would be fantastic. Just find out sort of what mix of people we have in the room and in the virtual room, that is. And yeah, it'd be great to sort of see what the mix of people are, just so then we can find out about you guys as well as us talking throughout. It looks like we've got a lot of the NGO sector coming in.
Carolyn, just very quickly, would you be able to take down the chat box that is a separate square from your screen, just because we've got a black box in the corner? No problem, thank you.
Sorry, yeah. Great, well, it looks like we've got, yeah, a lot of the NGO workers here. So let's go on to the next one. There we go. Which country are you calling in from? This will probably go crazy in a second, hopefully. It'd be great to see yeah, where everyone is dialing in from. Oh, already we've only got a few words on the screen, and you can see the diversity of the, I think we're crashing the system as we go, which is sort of a good sign as well. Yeah, so it looks like we've actually got people from a few different places. Thanks to those who are calling in from time zones that are a little bit more difficult for this time of day. So well done, special mention to you guys. I think we're just crashing the system at the moment, but we can always come back to that. Don't worry, your answer's saved, so it's just nice for us to know who's involved. And then, yeah, the last one, what is your reason for joining the workshop today? I guess it's just helpful to know, you know, is it just part of your job role, or is it more you've just got an interest in the area in general? Maybe you're new to sustainability and this is a great workshop to sort of hear from lots of different people about their perspectives. That sort of might show you're in the wrong place. So great that most people have at least something to do with sustainability. Brilliant. Okay, so thanks so much for yeah, our first little bit of interactivity and introducing yourselves in some way. And yeah, back over, oh no, still me. So one of our other interactive sessions that we're going to do at the end is going to be about getting ideas for how we move forward with sort of gaining some measurables. So all the speakers today have got so much to share their experiences, and what we're hoping for is that we can bring all this together and what will be our action points going forward. So we've made a little exercise. We will go over this at the end, but I just wanted to introduce it at the beginning in case while we're going through the speakers, while you're listening to all the different perspectives, it might sort of help you jog some ideas, motivate you to think about actually how would we start? If it was a house, what would we start with? How would we build that foundation? We might not be able to see anything, and actually sometimes you have to go down to come back up, but we want some really solid foundations there for what we're moving forward in sustainability. So when you're listening to the speakers, what are they saying that is triggering in your mind? Right, we want this to be the beginning. What would be some of those things that we'd look for to start our sustainability building? And then when we're thinking about the next steps, it might be what's the sort of structure of the house? What's the basics that we would need to see there? What's going to, you know, protect us in our house going forward? And this might be things to do with ensuring we've got some resilience to our programs. What's going to protect us in there from those outside elements and make sure that our programs are going to be safe inside the home? And then lastly, this might be the sort of blue sky thinking, where do we want to end up? What would be the success? When we think about, you know, our homes, we might think actually it's using self-sustaining technology, maybe a, you know, a water-fed system, that rain collection water system, it might be solar power, things like that. What is going to give the energy to the programs so that make sure they're self-sustaining as we go through? So as I say, we're going to do this exercise at the end using the interactive Jamboard, but just wanted to introduce it now so that you can get the most from the speakers and start thinking, actually, you know, what are some of those components, and that'll help us map out something, yeah, to get us all going after the speakers, rather than it be a more briefing. We want it to be interactive and actionable content at the end. So great, thank you so much for that. And I'll pass over to Aparna to introduce the rest of the session.
Great, thank you. Thanks very much. So we're now moving on to taking a look at the objectives of today's session. It's really great to have everybody join us and to kind of get stuck into some of the interactive elements of today's workshop. So as you'll see from the screen that we're sharing at the moment, we've set 5 objectives, which we hope to cover in today's workshop. And the session as a whole really aims to facilitate a deeper understanding of the soon to be launched WHO Sustainability Framework for Action, and an opportunity to work through the adoption of the framework and the significance for NTD programs, cross-sectoral collaborations, as well as the expanded partnerships to deliver on sustainable impacts. So you'll recognize through some of these objectives that, we understand that the global context is quickly changing, and that with COVID-19, it's clear that all countries will face significant challenges to creating and maintaining sustainable health systems. So hopefully, through understanding the framework for action, by reviewing and reflecting on the complementary NNN sustainability statement, and also a discussion through our panel discussion later today, we'll have a conversation around some of the examples of successes, challenges and opportunities to be able to mobilize the framework for action for sustainability. And we hope at the end of today's session, we'll have an idea on how we might progress with developing measurabilities for sustainability. This is an area of work that the NNN cross-cutting group on sustainability is really keen to move forward with over the next couple of months. And ultimately, we really hope that these conversations support transparent community conversation and learnings across different WHO resources, as well as tools for the new roadmap. So moving on to what's brought us here today. Carolyn, could we have the screen?
Yeah, we're just, I'm just having a technical difficulty. Keep going.
No problem.
We'll be on in a second.
No problem. So in terms of looking at what's brought us here today, I wanted to provide a little bit of an introduction to a timeline of events. So since the 2012 WHO NTD roadmap and a renewed coordinated commitment from NTD stakeholders through the 2012 London Declaration for at least 10 NTDs, the global NTD community has really seen a significant progress towards control, elimination, and eradication. However, serious challenges remain in order to sustain the impact of progress to date and to support those neglected diseases that remain neglected, as well as the scaling up of cross-sectoral collaborations and the interventions beyond preventive chemotherapy treatment. Since 2012, we've seen new diseases and groups of diseases added to the WHO's now list of 20. The global health agenda has also evolved to a better understanding of the transition from the 2000 Millennium Development Goals to the 2015 launched Sustainable Development Goals, also known as the 2030 Agenda. And through the UN member-endorsed SDG framework, we continue to learn and understand the interconnectedness of health, livelihoods, gender, education, global partnerships, climate change on making sustainable progress towards a more equal world. So reflecting this shift in the global agenda, the NNN as a platform of NTD NGO stakeholders established a cross-cutting group on ensuring sustainable systems in around 2017 after an NNN conference on the same topic. And the NNN cross-cutting group's first exercise was to develop a common understanding of sustainability within the NGO community. This involved conducting a stakeholder-wide survey alongside literature research and consultation with health ministries to culminate into a living NNN statement on sustainability, which you might recall was launched at the 2019 conference in Liverpool. Now, we recognize this is an area of continued growth and learning, and we welcome WHO's leadership in holding sustainability as a core pillar to achieving the work of the new 2021 to 2030 roadmap. As WHO prepares to launch the roadmap, we are equally excited for the accompanying tools to be launched. These include the WHO Sustainability Framework for Action, the updated NTD WASH strategy, a monitoring framework, and an investment case, all of which will be crucial tools to support NTDs and cross-sectoral stakeholders in realizing our joint vision and ambitions for the new roadmap. So as I mentioned, last year we launched the NNN Statement on Sustainability, and you'll see the text is up in front of you at the moment. Now it's important to recognize that the NNN Statement on sustainability. It's available on the NNN website, but it's a living document and it's a living statement, and it continues to shape the way in which the NNN engages in the sustainability agenda. It really seeks to develop a common understanding of what is understood by the term sustainability in the context of NTD programs. And you'll notice from the text that it centers this understanding on government's long-term commitment with multi-level and local commitment. And it also identifies three characteristic components of sustainability. 1, domestic commitment. 2, resource mobilization. And 3, accountability. All of which are strongly aligned with the WHO Sustainability Framework for Action, as you'll learn more about later. And now I'm handing back over to Carolyn for some quick polls.
Great. So thanks, Aparna. That was a great summary. So we're just interested to know, sort of understand the reach of the NNN sustainability statement. So it's anonymous, so don't worry if you've not heard of it before. You're not going to be named and shamed on the screen, but just really great for us to sort of understand, yeah, sort of who's heard of the statement. And yeah, and then the next one is, great, we've still got a few people answering. Brilliant. The next one is, have you actually read the full statement? And yeah, what is your, like, or have you just seen it like this in presentations in part? So again, really useful just for us to know. Brilliant. We've got good answers. Great, super helpful. Aparna, just over to you to give a bit more background there.
Great, thank you very much. So in recent years, a series of new tools and resources have been developed to support program managers, health ministries, and implementing partners navigate what it means and how to create sustainable interventions and programs that deliver sustained impacts. On this slide, we've listed a few examples of monitoring tools, as well as some examples of disease-specific resources that might support you in your work on sustainability. There are a few more additional tools, and we'll be happy to collate these after the NNN conference that will help you, but we thought for today's session, this would be a helpful signpost towards some of the resources that currently are being used by NTD stakeholders. So we have USAID's framework for supporting sustained development, a sustainability maturity model assessment tool, the SIF-Dalberg NTD sustainability assessment tool. We have some examples from cross-sectoral collaborations, such as the 2019 launched WHO and NNN WASH NTD toolkit, a WASH and health working together, a how-to guide for NTD programs. And this particular toolkit really includes some processes to help build some of the cross-sectoral relationships required for sustainability in NTD programs. And then another example from a disease-specific approach is on trachoma. And this is a 2019 launched transition planning toolkit. And the toolkit encompasses 3 tools across trichiasis surgery, MDA, as well as facial cleanliness and environmental changes. And the idea behind the toolkit is that it is to provide some how-to steps around transitioning elimination programs into routine public services. And then we've also provided a link to the draft sustainability framework for action, which we are going to hear about a little bit more shortly. So now over back to Carolyn for another quick poll.
Great, so thank you. This is the last of our little polls, and we just want to know, does your organisation have its own sustainability framework, or are you using one of the ones that we have mentioned? What would be fantastic is if your organisation has published or you have a sort of live document that's for the wider community, that feel free to put that in the chat. That would be fantastic to see what people are using if it's not one we've already mentioned. I mean, here we can really see quite an even split where, you know, some people are using sustainability frameworks and some aren't. So absolutely brilliant opportunity to share anything that you have done before. And obviously there's the opportunity to join the working group as well if you want to collaborate further. So brilliant. Now, sorry, next poll. I said last poll, not really. This is the last poll. Has your organisation sort of established the processes for enhancing your understanding of sustainability or health system strengthening? Because sometimes those are used differently or interchangeably depending on your exact work. So yeah, just again, really interesting to know about how we're spreading this throughout our organisations and how we're spreading that awareness of sustainability. Fantastic. So it looks like there's a great proportion who have, so that's brilliant. And again, if you do have anything to share about the process that you've used in your organisation, that would also be really interesting to know about. So feel free to put something in the chat or email me and Aparna after the session. Great. Aparna, I'm going to stop sharing my screen and I'll let you take over for the next section.
Sure. Thank you very much. So it's my pleasure to introduce Gautam Biswas from WHO. And Gautam today will be introducing us to the work the WHO Working Group have been preparing on the Sustainability Framework for Action. So if you bear with me a moment, we'll just do a quick change in screens. And over, oops, a little bit premature. Great. And now over to you, Gautam.
Thank you, Aparna and Caroline, and to NNN to invite WHO to join in this workshop. And it is very interesting. I think the way you introduced the topic with all the polls was really exciting. So good morning to everyone, and good afternoon or good evening, depending on where in the world you are. Even though I saw most people are around the central part of the world, I mean around where we are, but I think the polls sometimes might not capture the entire responses. So the idea that I'm trying to go through in the next 10 or 12 minutes is to just introduce the sustainability framework. It is still in the draft stages. It is still under development. Many of you might be aware of that WHO is now building the next roadmap. The first one was from the 2012 to 2020. This is the year which is the last year of the previous roadmap. And so going forward from 21 to 2030, the idea was to have a new roadmap. And the new roadmap was developed through a lot of consultative process. And it has mainly three shifts. The first shift is moving from basically processes to impact. And no, it is not in the slide. So just to introduce you to the framework. And the second shift was from the traditional way of doing things by very disease specific and very siloed approach to a more integrated and mainstreamed approach. And the third shift is from a outside driven initiative to a bigger country ownership. So if you see, all these three shifts are mainly related to making the NTD interventions and program more sustainable. Now, during the course of the various consultation, and it was realized that, you know, just having the roadmap and its targets and a simple way of how to implement the roadmap would not be enough, and there would be some additional documents which might be helpful for countries and partners and stakeholders as they plan and implement the path on the new roadmap. And Aparna in her introduction introduced the other documents, and one of them is the sustainability framework. And we started with sustainability framework, but then we very consciously added the word for action. So it is not just a theoretical aspect of what is sustainability and the elements, but how can programs really translate this into action at the country level. And I would also like to acknowledge the support we have received from consultants from RTI and R4D, supported by USAID as a drafting group in this process. So what are the objectives of this framework for action? So the idea is to detect the sustainability gaps in the NTD services, as well as to anticipate what kind of gaps might occur in the future or evolve, and develop priority outcomes and activities to address these gaps. And the second objective was to develop a country sustainability strategy. Again, the importance here is not to develop a strategy on its own, but one that is embedded in the national health policies or the national NTD plans. So I think one of the things that upfront we had decided that this should not give an idea that people have they have an NTD plan and now they have to make an NTD sustainability plan. No, the idea is that when they make the plan, the elements of the sustainability is built into that plan, and that is where this framework comes into play. So just going forward, I think Aparna, you showed the statement, the NNN statement on sustainability, but we in WHO have from the NTD, we have defined it, and this definition is actually based on the Universal Health Coverage 2030 definition. So we tried to keep it in line with the basic definitions and kind of adjusted it or adapted it to the NTD. So it is the national health system's ability, and again is the emphasis on the national health system, even though most of these systems will be supported by external partners and other implementing partners, but its ability to maintain or increase the effective coverage of the interventions to basically achieve the outcomes and targets that are being identified in the NTD roadmap. And if you recall, they are under overarching targets, and then there are the cross-cutting targets and disease-specific targets. So basically, whichever is relevant for those countries, depending on the disease endemicity, the idea is how can they achieve those goals. Coming to the next, who it is for, again, mainly for the national policymakers, both at the national level, but also at the local government, because we have realized as a course of the discussion, the roadmap, that much of the decision and actions are taken at the local government, while sometimes we as WHO interact much at the national level. But if we want programs to be sustainable, we have to encourage the local governments and local programs to also talk of the sustainability, and also the NTD program managers, the donors and implementing partners. I was impressed to see most of you are implementing partners in NGO. It's an NNN meeting, of course. So I think this would be interesting to you, and of course, academia and research. Now, as we said, all of the roadmap and its documents are done through a very consultative process. So we have a steering committee, which is constituted of the director of NTD of WHO and all the regional focal points of NTD. But for the sustainability discussion, we have enlarged this group to include our experts from the health systems. And then we had an online survey and interviews and literature reviews, webinars, and other things. So whatever we are drafting is as a result of all these inputs. And thank you to many of you who are participating in this workshop today to have contributed to this process. Next slide, please. One of the things that I wanted to, this is just one of the slides from the set of analysis, and this is from the highest ranking health services systems building block in determining sustainability of NTD interventions. We had asked people to rank various indicators against these, and if you see the blue one, which is on leadership leadership and governance, which is also related to the political will, was one of the key determinants that people thought would be important for the sustainability. And the next one was the financing, more so in the vector-borne disease. But again, I don't want to discuss this. I was just mentioning that how we evolved in the roadmap. And this was basically used these into kind of drafting the NTD sustainability document based on what are the determinants of NTD programming, the key inputs, and other things. Next slide, please. So come to the, this is just to share the concept. And if you see the, sorry, we can't use a pointer somehow, but if you see the left-hand side, the gray or greenish gray, these are the roadmaps cross-cutting approaches on integration into common platform, mainstreaming, and coordinating. The thing is, how do they interact with the health system? Again, you see the leadership and governance coming as an important, and these are the 6 building blocks of the health system, but they're also related to where the gaps and where the online survey said, was very important was the leadership and governance, financing, and also the access to medicine and products are part of and the health information systems, and also identified as the major cross-cutting gaps in the roadmap. And these then lead to the NTD milestones and also the UHC outcomes. And in the overarching thing, I mean, 3 components, 3 things kind of have a lot of input into this, which is the political economy. When we say political economy, we meaning the political will and the executive will, the epidemiological understanding and the spread of diseases, single disease, multi-disease, and the knowledge of the social context. So this is basically on which the sustainability framework is built. And next slide, please. So we have the starting point. And again, if you see the starting point, what we are recommending is not the NTD plan itself. It has to start within the National Health Policy and the National Health Strategic Plan. And this is one of the part of the shifts that we are proposing, that if we want our NTD plans or interventions to be sustainable, they have to be part of the National Health Policy. They have to be part of the local health plans. And then this will lead to the expenditure framework or budgeting. Again, I mean, one of the element of measurement of the country ownership is how much have the countries adapted to these, how much of domestic financing has been put, or at least there is a budget line for these, even if the funding is coming from external sources. Next slide, please. So we have these 5 kind of steps. They may be sequential, but depending on the country, because we know that it was very clear that every country is one size will not fit all. Every country is in a different situation of maturity, and so someone will have to start from 1, someone may have to start from 3. But basically, the first is the working group. There is the thinking of having a multi-sectorial working group, which will be best to decide on the planning, and then the second is these identifies key stakeholders, and in each of these boxes you will see the output and a proposed tool. So the tool is proposed in the framework, that how that can be used to get that output for these 3. So the third is the assess the gaps and then develop the priorities and then implement, monitor. I think I liked Aparna, you mentioned the issue of measuring the sustainability, which is again an important aspect which we are now working on. Next, please. So as I said, this is kind of a decision map. Everyone doesn't have to start from the sequence of 1 to 5, but depending on the stage where they are, they can go to 1, or they can start from the stage 4, or even start stage 5. Next. So this is the kind of timeline we have. Next slide, please. So we have this timeline, and we are now in September. and before this, we had done all this consultative process of online surveys, individual questions, stakeholder interviews, both for countries, stakeholders, academia. So now we are working on the writing part of this framework, which will again be reviewed by the steering committee and the stakeholders. We will at points of time make it public. And we hope that the roadmap will be reviewed by the assembly in November. So we will also have the framework ready by that time. Next slide, please. So I would conclude with saying that, if we want to have the sustainability framework as a practical and action-oriented guide for people working at the country level, whether it's the Ministry of Health or stakeholders and partners, and help countries plan for NTD services that will maintain and increase coverage. I mean, this is in relation to the definition, and we are requesting the NGO and community and the supporting partner countries in building elements of sustainability in the NTD plans. I think one of the things, and I guess we have come a long way when we used to hear that, the implementing partner, the country Ministry of Health complaining they don't know what the implementing partner is doing, and implementing partner is complaining that the country is making plan without taking into consideration many things. But I think those gaps are now merged and much less to be seen. And I think if we are all aligned to the roadmap and the sustainability framework, one could work as one entity, and that would also lead to a lot of sustainability in the programs. And we are also looking forward to the case studies, because this is yet a bit untested area for at least in NTDs. There might be some experiences in other areas, and we believe that we are cognizant that this may not be, everything may not have been done rightly in the first version, but the idea is that if we implement that, and if we have case studies, we will continue to improve the framework, which would benefit the countries best. So I conclude here with a big thank you, and I would like to also thank my colleagues Xiaoxian and Pamela, and also the drafting team of RTI, which has helped in drafting and also helping me prepare this presentation. Thank you very much.
Wonderful. Thank you so much, Gautam. I hope for many people on today's workshop, this will be a really interesting oversight or overview rather of the draft framework for action. I'm really excited to see how this develops further, ready for its launch later this year. So we're now moving on to our next component of the session, which is a short panel discussion. We have 4 invited speakers participating, and we'll have about 20 or so minutes for this session before moving on to an interactive exercise. I just want to comment from Gautam's presentation that it's clear a phenomenal amount of work by WHO and NTD stakeholders has gone into the development of this framework. And I'd really encourage participants, please do add as many questions as you may have on anything you've heard today so far in the Zoom chat box. Carolyn and I will be using these questions at the end of this workshop to help collate answers if we don't have a chance to address them today. But hopefully some of those questions will be answered next as we enter a panel discussion with stakeholders from constituencies across WHO, national government, NGO, and donor communities. The sustainability and health systems agendas have been a growing area of focus for NTDs. At a time when global resources are increasingly constrained, even more so with the expected global economic crisis from COVID-19, all of our invited panelists will be asked to reflect and to challenge us to identify and develop approaches to build sustainable and resilient health systems. So our first question is based around successes. And our first question is to Gautam from WHO. From WHO's perspective, what does sustainability and success in health programs look like? And what can we learn from other health programs across WHO regions?
Okay, thank you, Aparna. As I said, I think first of all, I think we need to realize that the spectrum across which countries are is very vast. I mean, some are at the beginning of the sustainability and struggling and basically dependent on external resources and support. And also, I want to mention one thing, clarify one thing. Sustainability does not always mean having financing. I think there is a lot beyond financing that lead to the sustainability. So from what I can recall, I think that we can share some experience on this. For example, I could take the example of Guyana in our Americas region, where both malaria and the LF elimination program, which was initially very much dependent on the external funding, has really moved to the domestic financing and incorporated within the health system in Guyana. And again, these then you could come to Asia, where also traditionally, I think in Asia, many of the countries are kind of self-financed, supported by domestic financing, even if they are, maybe the medicines for NTDs come from the donation, but many countries also procure the medicines themselves. And thinking about some experience, again, I think from the immunization background and from the Gavi supported countries, I think there has been a lot of countries who have moved from the Gavi support to their own. And I think if you come back and look at the reasons why they have been successful in this way, and some of these experiences have been incorporated into the sustainability framework. Again, comes down to one is the commitment from the government itself. I mean, how committed are the governments and in moving in that direction? And the other experience one could say is the longer the country is dependent on external resources, the longer it takes to wean off the resources. So that was another experience that we kind of found. And where the countries have moved into having their own strategy, the process of sustainability have been easier. Again, I can give examples like Vietnam and Indonesia, which have moved away from the Gavi supported immunization to the with self-dependent. And again, capacity building is one of the other area. But it is also interesting to hear when we were having these discussions on the sustainability, that we heard that sometimes when countries are also having a lot of their own domestic financing and not dependent on external financing, excuse me, sometimes a little amount of very tactical financing or flexible financing can do wonders in that country. So I think even when we're talking of sustainability and domestic financing, the importance of external financing will continue in different phases. So just to share, I mean, I'm not sharing the names of all the countries. I gave some examples, but I think we have a good example from, there's a lot of good examples from the TB programs, actually, who have moved away from the global fund into the domestic sustainability areas.
That's wonderful. Thank you very much, Gautam. I think that gives us some really helpful directions to kind of explore further case studies for us to learn from and inform our discussions as well. Thank you. So now we head over to Fikre Saif, National NTD Team Leader at the Federal Ministry of Health in Ethiopia. For Fikre, our question to him is, what are some of the challenges to addressing sustainability in NTD programs?
Hello, everyone. This is Fikra from the Ministry of Health Ethiopia. I am the National NTD Program Manager. Today, I am here just to share you about the NTD program sustainability work here in Ethiopia. The first challenge is you may face a number of challenges in terms of developing the a national NTD program, NTD sustainability guideline document or plan. Under this, the first challenge is so far we encountered was there was lack of sufficient information in terms of program challenges, gaps, successes, priorities, and we don't know exactly what opportunities do we have. So as a solution, it is very important to conduct a kind of formative assessment by involving many stakeholders like governmental and non-governmental partners, donors, and the actual beneficiaries, the community itself. So we will get sufficient information just to know where we are, where exactly the NTD program is. If it is necessary, it may be important to organize a kind of desktop, desk review, just to generate knowledge in this regard. The other main challenge is it's not an easy task just to bring all the stakeholders that are working in different sectors. So maybe if we want to organize a workshop, it's not an easy task to bring on the same board, just maybe for a workshop and so on. The other most important challenge is lack of budget to carry out all those activities. As I said, we may need to have to conduct a kind of formative assessment and information gathering and so on. Also, we may want to have a stakeholder consultative workshop for this. Government may not allocate sufficient fund or budget for this activity. So I want to bring this attention for the NTD donors as well as implementing partners. So sustainability is one thing that each implementing partner as well as donors need to have in their plan. The big challenge here is lack or poor ownership from the government as well as the higher political leaders. And the other big challenge we may encounter is lack or inadequate domestic financing. This is mainly due to the presence of various competing health priorities, like the big three communicable diseases, HIV, TB, malaria, and so on. So, as you know, the morbidity as well as the mortality impact of NTDs is not visible immediately. Rather, it is a long-lasting impact that will be bringing in the socio-economic development of one's country, so that political leaders and administrative people who are in all administrative levels may not give a priority attention for entities. So this is what we are now, what we are facing right now. There are also some gaps in local knowledge and information generation. Mostly the evidence that are generated for NTD implementation as well as monitoring and evaluation are generated from the external, the global communities, basically from WHO and other research institutions which are based in abroad. So just to have a sustainable impact in the NTD programs, we have to capacitate the local universities and the research institutions in terms of generating new knowledge as well as information. So by this, we can assure the NTD program sustainability, and we will bring a long-lasting impact in those diseases.
Wonderful. Thank you so much to Fikre for his response. I do want to add that Fikre provided us with a much longer and comprehensive response to some of the challenges being faced by national governments. We don't have necessarily time for the whole response today, but we'll be sure to include the full response in the recorded version of this session. So moving on to our next question, our next speaker is Richard Killian, who is the Health Systems Lead at RTI International. The question is, what must NGOs be ready to support with when it comes to the research, policy and programmatic changes needed to drive the generation of evidence and the adoption of evidence-based decisions to support sustainable systems?
Hello, everyone. Good morning, good afternoon, good evening. Thank you, Aparna, and thanks to NNN for inviting me and the USAID's Act2 NTD's East program to participate in the panel. Let me start by saying that the reason sustainability is so important now is because NTD programs have demonstrated tremendous progress to date. It's because of this success that our next effort must be to look at the opportunities ahead, and particularly how we can apply the capacity that has been built to maintain or expand upon the accomplishments and have a more holistic, sustainable approach to NTD programming. To do so, we need a paradigm shift where we look at how NTD programs fit into a national health system. And for Act East countries with whom we partner, this paradigm shift has already begun. As a USAID supported program, Act East is working with countries to think about NTD sustainability in the context of their national health system strengthening efforts. And our health system strengthening and sustainability approach for NTDs builds upon global frameworks and goals, some of which we've been involved in developing. And you heard more about the work on the WHO sustainability framework for action from Gautam earlier. This has been an insightful process and has revealed priority areas that need to be addressed. And I'll give a few examples where NGOs must be ready to support. First, we need to do our research and have humility about who the experts are. Act East initially conducted health system strengthening for NTD's desk reviews for a number of countries, and then supported the ministries of health in Uganda, Tanzania, and Ethiopia as they conducted sustainability assessments. And these assessments, in which countries took a closer look at how integrated their NTD programs are with their national and subnational health systems, were done in tandem with gender equity and social inclusion, or GESI analyses. And I'll say a little bit more about GESI in a moment. These assessments have been very enlightening, both for the countries and for us as an implementing partner, as we've learned about the priority areas that do require more emphasis, and also just how they look different for each country. As examples, and these are really just a couple of examples, the assessments have highlighted the need for stronger linkages between NTD programs and the health management information system, as well as the need for more focus on domestic resource mobilization, utilization, and monitoring. And Act East is responding to these priority needs through working with the countries on developing national sustainability strategies or plans in a few of the countries, and by supporting the strategies and activities to address those priority needs, for example, related to HMIS and to domestic resources for NTDs. And Dr. Fikre mentioned earlier about needing more and better information to support advocacy and around NTDs. Second, we are assisting ministries of health to collaborate more widely on NTD programming, and emphasizing the vital coordination role that governments need to play with a broader cross-section of stakeholders beyond NTDs and also from outside of the health sector. And we're supporting governments in the process and also doubling down on our own engagement with other implementing partners, such as the Act2 NTD's West and the Ascend program. This coordination has included an exchange of information and collaborating in in-country sustainability activities, such as the assessments and planning workshops that I mentioned earlier. And this expanded coordination and collaboration is increasing our ability to provide countries with the kind of diverse and comprehensive support that they need to strengthen sustainability. Lastly, sustainability must be for all, for everyone. We need to emphasize the role of gender equity and social inclusion to ensure that no one is left behind. And this is an area of great importance when we consider sustainability planning, particularly as we are reaching the last mile in diseases and countries successfully stop in MDA campaigns. And success in reaching the last mile is an important determinant of the mix of interventions and resources required at the country level in the campaigns against NTDs, and therefore helps define what sustainability will look like in a country. Put another way, the first mile can look pretty similar across different countries, whereas the last mile is the hardest and always more variable. So I'll stop there for now. Thank you.
Thank you so much, Richard. In the interest of time, we'll move over to our final panel speaker before providing a brief summary. Our next, or rather our final question for today's panel goes to Karen Palacio, who's the Associate Vice President of Programs at the End Fund. Karen, so far we've heard from WHO, from national government, and from an NGO their reflections and journey to sustainability. But we recognize, at least in the short term, we still need to mobilize catalytic support for the early planning, as well as the integration of NTD plans into broader health plans. So the question for you is, what motivates donors to share a vision on sustainability and health system strengthening? And how can the NTD community mobilize resources for sustainability and health system strengthening within NTD programs?
Great, thank you, Aparna. And good morning, afternoon, or evening to all. And thank you so much for NNN for inviting the End Fund, of course, to join this important session. The successes achieved over the last few years on NTD control and elimination are no doubt due to the strong partnerships and collaborations between government, UN agencies, civil society, academia, donors, and the private sector. And these types of successful partnership models and the ability to work together to reach the milestones in the WHO 2030 NTD roadmap and beyond are what we feel motivates a shared vision on sustainability and health system strengthening among donors. End Fund, just as an example, recently experienced this by leveraging our network of private sector and philanthropic donors to work in partnership on the installation of communal and household hand washing stations in multiple African countries as part of our COVID-19 response. We also saw it very evident in countries like Zimbabwe, where our partners, the Higher Life Foundation and the Zimbabwe Ministry of Health and Childcare, are not only working to address NTDs, but are also collaborating on broader health, water and sanitation, and hygiene initiatives, and now hand washing campaigns as well to prevent COVID-19. And I raise these because we feel these locally driven solutions are what are sustaining NTD progress made throughout the year and really better positioning countries to not only deal with pandemics and future outbreaks, but also to provide solutions that the NTD response is able to leverage and build on for greater impact. Our funders are also supporting strengthening of the health workforce and coordinating mechanisms that really allow us to support local priorities and needs. So for example, in Rwanda, we've supported the inclusion of NTDs in community health worker training to ensure there's a sustainable and durable workforce to maintain those health gains achieved through MDA over the years. We're also seeing an unwavering level of support to end NTDs to provide an opportunity to scale up proven approaches, trial new innovations, and foster increased levels of community participation through different philanthropic collaborative fund models that support these efforts. And as noted earlier from the other panelists, a critical aspect to all of this is, of course, country leadership and capacity, which are essential to sustaining the program so that they're integrated and built into the health system. So as part of the sustainability framework, we feel it's critical that countries develop these plans that build upon and utilize existing country resources and systems to more efficiently deliver NTD services. we of course agree with what others have said, that this should really include an assessment of financing models that includes domestic contributions for service delivery or to purchase quality drug or diagnostics, and that really leverages the existing cross-sector platforms such as nutrition, education, agriculture, WASH, and economic development. We also feel accountability mechanisms to measure those impacts and robust and comprehensive local and global advocacy are also needed to drive awareness of NTDs in country ownership. And recognizing, that national NTD programs vary in stages of maturity, the sustainability framework allows programs to really assess how and what to prioritize in order to engage all stakeholders, including donors, to operationalize plans and play a complementary role. And lastly, touching on what some others have said earlier, there's no one financing model that fits all. Financing for countries will inevitably be a mosaic of different financial instruments, from domestic public funds to bilateral and multilateral donors, philanthropy and investors. But that should provide the flexibility for countries to pool resources to support national sustainability plans with a long-term view of really growing domestic financing models for resilient health systems.
Thank you so much, Karen. I feel like we've had a really good mixture of reflections and perspectives from a whole host of different constituencies this morning. I wanted to bring up one question from the Zoom chat box, and this question is open to all of the panel discussion participants. The question we have is, many countries are in the process of updating their national NTD master plans. The linkage with the NTD master plan and national health policies, strategies and plans, along with the framework for action, seems relevant and important. Are those linkages apparent in the NTD master plan template? Perhaps over to the panel to see if one of the members could respond.
So, can I make a go, Aparna, at it? Gautam
Yes,
here?
please do.
Yeah, okay. No, I think this is a very relevant question from, I think it's from Philip. When you say NTD master plan, it then generally refers to in African context. But I think even if you, so we don't want to kind of categorize by master plan, but whether it is a plan, master plan, multi-year plan, or whatever it is, I think it is important that as we go forward, and if you recall my second or third slide where we talk of the entry point is through the health system, and we are working with our colleagues in Afro, where this template is now being revised for the next round of planning, that sorry, lost my track. So we are working with our colleagues in Afro to ensure that the template adequately includes those elements. So rather than just sitting down, the NTD program manager sitting down and making his subsequent year's plan, I think what we are asking them is to link with the health system people, the policy makers, so that it doesn't remain just an external or an outside the health system plan, but it is part of the Ministry of Health plan. And again, as I said, it's a spectrum around. Some countries already have that, and some countries have to take those steps. So clearly a very good question, and we can assure the group that at least from WHO, we are trying to work on this aspect.
Thank you so much, Gautam. Finally, I'd like to thank all of our guest speakers for their contributions today. I hope some of your questions have been addressed through the panel discussion. If not, please feel free to keep putting your questions into the Zoom chat box. And as I mentioned before, Carolyn and I will be ready to help collate answers to them after the session. Our next session is an interactive element, and we'll be doing this for the next 15 or so minutes. Carolyn has just put up a link on the chat box to the Jamboard. We're going to hand over to Carolyn for instructions on the next piece of work. Thank you.
Great, thank you so much. And thanks again to all the speakers. Fantastic and so much points of view to consider, and just to sort of unpack some of those panel discussions, and also utilize your experience in what you've done before. We wanted to bring it together in this part of the interactive sessions. So the way that we have framed it is, this is called the Jamboard. So you'll be able, I'm just sharing my screen, but you'll be able to click on that link and edit this screen in a live way. We've had a couple of deletes, so just don't hit the delete button on anyone else's sticky notes. But basically what you do is you move at the top through these slides. So we've got 3 slides that you can put some sticky notes on. And the way to do a sticky note is if you click on there, you can put something in, I'll just write my name, just an example, and you can save it on there, and then everyone else can also see your sticky note. But obviously, if you don't write your name, no one's going to know it's from you. So this forum is really just to, not to ask people to explain themselves or to give a big interview in front of everyone. This is just simply to get some ideas down. So the way that we've tried to think about it is about if we're building our sustainable house. So the 3 slides are really encompassing what do we need to think about at the early stages when we're building that stability and building the structure that's really going to offer support to everything else that we do going forward. And we heard some things there from the panel discussion about when we're thinking about, you know, financing, what would the early stages of that look like? Because we heard some of the successes that Gautam told us in other countries in relating to other programs, and we heard them say, you know, that they did have more flexible financing models, but what might be some of those early stages, early signs that we can see as implementing partners or as country representatives for setting that off in motion? And I think the reason we've come up with this type of exercise is really to think about, actually, we can see that, you know, we've all starting to get our frameworks. We saw in the poll earlier, a lot of people have some frameworks coming into action. A lot of people are really putting emphasis on the area of sustainability. But it is actually quite hard to start and also to allocate budget when you're not really coming together as a community and having those shared definitions. So this is really the objective, is just to try and think, how do we bring it all together so we can start thinking about how to actually move forward. So this is absolutely fantastic. We're getting some great comments in so far. Also, the aim of what we're going to do today is invite obviously as many comments as possible. Clearly we're not going to get to any sort of consensus in the next 10 minutes. So what we were aiming to do is also have this as the foundation for our exercise that we're hoping to do within our NNN sustainability group. So we would love to have ideas on here, but also if anyone thinks, you know, I've actually got, you know, a lot I can contribute here, or just motivated to join in on the discussion to a bigger capacity than just this workshop, we would love for you to contact myself or Aparna, either on the NNN platform or email, whatever method is fine. And hopefully we can have a real full day workshop. So great, we can see some of the points coming in here. So also, if you are typical that my phone's ringing at this exact moment. And if you also click through to the next slide, you'll be able to see if you're thinking, actually that sparks an idea for later, you can put it in either the structure, or if it's something like, you know, blue sky thinking, or maybe some of the examples that Gautam gave us earlier about the successes, you might have picked out some points you think that's absolutely critical for when we are thinking about the future of the sustainability programme. If it might be in the far future, that's fine. So I can see some, yes, go on.
just very quickly, we're having some difficulty with everyone being able to join the Jamboard. So we're also navigating people who can't join the Jamboard. So please feel free to put comments in the Zoom chat box, and we'll collate those comments. But at the moment, we're going to go off seeing the types of ideas that people are sending onto your shared screen. So that's really helpful. Thank you.
Brilliant, thanks, Aparna. Yeah, sorry for those who are having difficulty getting on. Yeah, it's a good sign though that we're all trying to comment, and so absolutely fantastic. We were worried that people wouldn't have as many comments, so that's great that we do. So yeah, I mean, I think we can, this is brilliant that we're seeing a lot of, also there's some similar themes here, so we're getting some things around policy there, and I guess there'll be a lot of overlapping thoughts here about embedding the NTDs into the sort of wider health programs, and also how policy is interacting with political will. Great, we've also got some things about system analysis, and then I saw one earlier thinking about how we can having like that sustainability planning, which could also overlap there. So we're getting some absolutely fantastic comments in here. Local champions, yeah, brilliant. And I think we can see a lot about the ownership coming through as well. Yeah, and I guess this is actually going back to the NNN statement on sustainability, where we can actually sort of start to group these into where we did have the themes about accountability, resource mobilization, and domestic commitment, and actually we can see these are falling into that. So we can really see a good step forward in what we could see as a workshop, sort of putting down what is the next steps after the statement. So yeah, I'm just wondering, this page is filling up really nicely. Oh great, so other people are on also about the structure. So yeah, we can see about transparency of plans, excellent. Yeah, people with the right expertise and also the financial resources to support that, which is fantastic. Not only government, but community ownership, definitely. And that's one thing that came across when we did our survey initially about the domestic drive, the community-driven ownership, which is fantastic, because that is very much in the sustainability theme. Yeah, flexible finance and models, we heard that from our speakers earlier. Yeah, great. So let's see on the self-sustaining if we've got some bigger points here. So yeah, just keep on firing the sticky notes down. Yeah, economic analysis, fantastic. So yeah, that sort of links in from the previous slides, thinking that yeah, we need to have the sort of earlier foundations of that, but then when we come to the self-sustaining, you can see the financial aspects coming across yeah, through that economic analysis. Brilliant. And continued public pressure, yeah, completely agree. So I think we can see that in many countries now, where that political will is shaped also by what is in the public. Aparna, is there any other points in the chat that are coming out?
Yes. We're getting lots of good content, really covering points around in terms of the foundation, making sure that there is discussion and agreement on a shared vision, also noting the importance of high-level commitment to the roadmap. Looking at, we've also got comments from people around the availability of assessment tools to measure impact, ideas on resource mobilization, accountability, transparency. We also have comments on the importance of building local structures to support sustainability. So looking also at participatory planning at all levels. So yep, some comments coming through the Zoom chat box. We've also got a note on time frame. So looking at the time frame in which these discussions and planning takes place. And also making sure when we talk about local participation, that we're also empowering and supporting local, or steering local leadership as well in these discussions. Yeah, thank you very much, everyone.
Absolutely fantastic. And so I think this is great if people can just keep on putting down their sticky notes. Yeah, to be honest, we weren't expecting so many great comments, so it's overwhelming to read them all at one go. So I think what would our next steps here will be that we will read all of these in detail. We can also download these as a PDF and share them. So I think what would be great is if people are on the link now, and we will also add the comments that came from the chat onto these boards, collate them all together, and we'll make that available for the people in this session on the NNN platform. And then as our next steps, which we'll give a bit more detail of shortly, is we'll sort of collate these into some themes and start picking that apart and thinking, you know, what are the key themes to come out so we can move forward and start to really think about the next steps and the role of the NNN working group within that. So again, just to emphasize that if people are now in this meeting and thinking, yep, I want to contribute, I want to be part of that going forward, then definitely there's that opportunity to join us in the working group to have more fuller discussions. Yeah, Aparna, any more last comments before we move on to the wrap up?
Sorry, just coming off mute. Yeah, no, just thank you very much to everyone who's been participating. In terms of some additional comments from the chat box for the Jamboard, lots of reflections on innovative action and that being needed and present at all levels, so at national and district. Also looking at, when we talk about sustainability, looking at community knowledge and involvement is equally important at the planning stage. We've also got comments on the need to leverage integration, mainstreaming and cross-sectoral coordination to maximize efficiency. And I think that's one of the things that is so incredibly strong and present within the new roadmap. Hopefully this year's conference really helps to embed these approaches in our collective work, not just within our NTD organizations, but also in the way that we work with other organizations in other sectors. Okay, so I think just for everyone to know, our colleagues at MYT are thankfully documenting all of the questions and comments from the Zoom chat box, so that Carolyn and I, after today's session, can look to address all of them after the session in our notes, to discuss them further with the cross-cutting group on how to move forward with these ideas. So thank you so much. And thank you, Carolyn, for facilitating the Jamboard. As you mentioned, it was an unexpected surprise for the Jamboard to be filled with people, but that's certainly a welcome problem to have. And such an interesting and wide range of ideas from this group to generate in such a short amount of time. So we're now coming to the end of this workshop, and I just wanted to share our collective thanks from Carolyn and myself to our invited speakers, and to all of you for your time this morning and afternoon and evening for this virtual session. As mentioned throughout the workshop, Carolyn and I will be collecting all of the questions shared in the chat box and be able to provide a document after that not only summarizes some of the high-level points that we've discussed today, but also address some of the questions raised that we weren't able to answer in today's session. This is a really helpful exercise for us as the NNN cross-cutting group on ensuring sustainable systems continues to analyze the different questions we have as a NGO community, and to also reassess what resources would be helpful for the NNN to develop in partnership with other stakeholders, and continue to look at how we can continue to support WHO in their role with implementing the roadmap. And so Carolyn and I would also like to encourage you all again to visit the NNN website to learn more about the cross-cutting group. If it's something that you've been inspired by today's session, please feel free to contact either of us through the virtual conference platform at our profiles or through the NNN website. And we'd love to have you all join the NNN cross-cutting group. Finally, we hope you found this session informative for your future national level discussions on the sustainability agenda, as well as within your conversations within your organizations. And I'm sure you'll agree with us that we're all incredibly excited to see a final WHO sustainability framework for action to help us in our collective work together. So a quick thanks to our generous sponsors at the NNN Conference. And finally, thank you to you all for your time this morning and afternoon. So goodbye from us. Thank you very much.
Thank you, everyone.
Thank you,
Thanks for all your
Aparna,
participation.
Caroline.
Thanks for your participation, everyone.